The American Association of Nurse Practitioners is putting Ed Neuzil of Allergy Sinus and Asthma Family Health Center in the spotlight. Neuzil, a board-certified fellow of the American Association of Nurse Practitioners, partnered with the Community Preventive Services Task Force to help them develop recommendations for school-age children struggling with asthma.
I was recommended by the American Association of Nurse Practitioners as more of an expert, with my expertise being in that of asthma. And so what we did is, it was an international study, a group of studies, in fact, that started out with over 100 studies, narrowed down to 33, of which 30 were actually looked at as interventions in school-age children and adolescents, and what interventions were effective and if they were effective.
They found evidence that early intervention delivered by trained school staff, nurses, and health educators in elementary, middle, and high schools actually diminished disease symptoms.
If I was to tell you that you have asthma, that may not mean anything to you. It may be fear, it may be, well, okay, what is asthma? An intervention could be training you as to what actually asthma is. And then you go, okay, well then what do I do about it? And so the use of inhalers, and now there's quite a few inhalers on the market. There's short-acting bronchodilators, there's also long-acting. And to show, and we're talking about children here now, we're not talking about adults, in the actual use of these inhalers, how to use them, which ones are proper to use. And so these would be the kind of interventions that we were talking about.
These interventions can help school-age children with asthma learn to recognize and manage symptoms, to use medications and inhalers properly, and to avoid asthma triggers.
Catching asthma or any disease process early, you know that your outcomes are going to be better. And so if we can start this in school-age children, we may be able to effectively affect COPD and emphysema later on in life, because undiagnosed, untreated asthma can lead to these disease processes without ever having smoked, because of the inflammatory process associated with it. So the earlier we look at any disease process, the earlier we diagnose it, the earlier we go ahead and start to treat it. These interventions can dramatically improve outcomes later on.
To learn more about the task force recommendations, or to get in touch with Ed Neuzil and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the Ed in the Spotlight story link icon on our homepage, yourhometownhealth.com.